Hi, this is attorney Mark Thush, where we ask attorneys and doctors from around Central Florida legal and medical questions that can help you. Hi everyone, today's guest is Dr. Nicole Ingrando, a chiropractor with offices in Longwood and Orlando, Florida. Today's question is from Patrick, and he asks, I was a passenger in my friend's car when we were involved in a car accident. After a few days, my aches and pains have gotten worse, and I went to my family doctor. They told me they don't take my PIP insurance, and now I'm not sure where to go. Well, let me ask you this, Dr. Nicole. What type of doctor treats people who have been injured in a car accident?
It's a great question, Mark. This can vary and often become confusing to most patients. The reason is that our healthcare industry is desperately lacking a primary care physician for the spine or the musculoskeletal system as a whole. Since patients in auto accidents complain of whiplash, headaches, or other joint problems, most have trouble identifying the proper steps to take when they've been involved in an accident. Most patients end up navigating their own pain care pathway and end up feeling like they're in a supermarket of pain services, where you only get what that doctor gives rather than what you need. Some primary care doctors treat patients in auto accidents, as do chiropractors and hospital emergency departments. Irrespective of where you go, the most important initial goal is to have an exam performed and to rule out any serious injuries. We refer to these injuries as red flags.
Okay, well, must I go to the emergency room before I follow up with another doctor?
Well, Mark, it's not necessary to go to an emergency room first. Many of the patients I see come to me via a referral from their regular doctor, maybe their family or friends. Often, I'm the first doctor to see a patient following the accident. The most important thing is to see a doctor in an urgent, timely manner and to be evaluated whether you have pain or no pain.
Okay, well, what if I didn't have any symptoms at the scene of the accident, but several days later I felt pain? Who do I go to now?
It's a great question, and it's common to not have pain at the scene of an accident and then experience it later. Part of this is due to the stress response of the body, and part of this is due to the physical demands of returning to our normal lives after the body has just endured an impact or injury. The healing process is inflammatory and can worsen with time. This is why it is important to be evaluated in an urgent, timely manner, whether you have pain or not. Even so, any of the doctors we discussed today can evaluate a patient once they start feeling pain and feel an evaluation and exam is necessary.
Thank you, Dr. Nicole Ingrando, with offices in Longwood and Orlando, Florida. Hey, thanks for coming on our show today.
It's my pleasure, Mark. Thank you for having me.
Hey, I hope you've enjoyed our show today, and remember, I'm a personal injury attorney, so if you or someone you know could use my help, give me a call. I'm glad to help. And don't forget to go to Facebook and like my page. That's Mark Thush, PA, so you can receive free updates of my video posts. I'll see you soon.